Before you skip this video, let me ask you something. If you were in the exam room right now, facing your Nclex, would you really be ready for those tricky gynecology questions that decide your pass or fail? In this video, we're going deep into 50 of the most critical Nclex gynecology questions, the exact type that confuse even top students. Each question comes with answers, rationales, and smart test-taking strategies that will make you say, "Now I get it." And here's the challenge. Stay with me till the very last question because I'll reveal the secret pattern that helps you pick the right answer even when you're unsure. If you can spot it before I reveal it, drop it in the comments below. Let's see who's truly Nclex ready. Question 1. A nurse is teaching a client about self-breast examination, SBE. Which statement indicates a correct understanding? A. I should perform the exam during my period. B. I should examine my breasts every day. C. I should perform it 1 week after my menstrual period. D. I should perform it before my period starts. Correct answer is C. I should perform it 1 week after my menstrual period. Rationale: hormones are stable 1 week after menstruation, reducing breast tenderness. Strategy: choose the least hormonal phase for accurate examination. Question 2. A client's pap smear shows atypical squamous cells. What is the most appropriate nursing action? A. Repeat pap smear in 3 years. B. No follow-up is needed. C. Schedule repeat pap smear in 3 to 6 months. D. Prepare for hysterectomy. Correct answer is C. Schedule repeat pap smear in 3 to 6 months. Rationale: mild abnormalities are monitored before invasive intervention. Strategy: early detection through follow-up prevents progression. Question 3. A client with endometriosis reports pelvic pain. What is the most characteristic symptom? A. Heavy bleeding between periods. B. Painful menstruation and dyspareunia. C. Absence of menstruation. D. Postmenopausal bleeding. Correct answer is B. Painful menstruation and dyspareunia. Rationale: ectopic endometrial tissue causes inflammation and pain. Strategy: endo equals internal misplaced tissue equals internal pain. Question 4. A client with PCOS asks why her periods are irregular. The nurse explains it's due to A. Low estrogen, B. High progesterone, C. Insulin resistance causing hormonal imbalance, D. Deficiency of luteinizing hormone. Correct answer is C. Insulin resistance causing hormonal imbalance. Rationale: increased insulin raises androgens and disrupts ovulation. Strategy: link PCOS to metabolism and hormone imbalance. Question 5. The nurse teaches about missed oral contraceptives. What should the client do if one pill is missed? A. Skip it and continue. B. Stop the pack for 1 week. C. Take the missed pill as soon as remembered. D. Discontinue and start a new pack. Correct answer is C. Take the missed pill as soon as remembered. Rationale: taking it immediately maintains contraceptive effectiveness. Strategy: missed pill, take now, continue as usual. Question 6. Which symptoms should be reported immediately by a woman on oral contraceptives? A. Weight gain. B. Breast tenderness. C. Leg pain and swelling. D. Nausea. Correct answer is C. Leg pain and swelling. Rationale: could indicate a thromboembolic event, DVT. Strategy, remember aches, abdominal pain, chest pain, headache, eye issues, severe leg pain. Question 7. Which finding suggests ovulation? A. Thick white mucus. B. Body temperature drops. C. Cervical mucus thin and stretchy. D. Cervix firm and closed. Correct answer is C. Cervical mucus thin and stretchy. Rationale: estrogen increases thin, clear mucus during ovulation. Strategy: thin and stretchy equals sperm friendly. Question 8. A woman with PID presents with fever and pain. Priority action: A. Encourage ambulation. B. Apply warm compress. C. Administer antibiotics. D. Schedule ultrasound.
If you're enjoying this video so far, like and subscribe. Welcome back.
Correct answer: C. Administer antibiotics. Rationale: infection control prevents infertility and sepsis. Strategy: treat infection first, diagnose later. Question 9. Postmenopausal bleeding is reported. The nurse should A. Reassure it's normal. B. Advise ovulation may occur. C. Refer for evaluation. D. Advise rest. Correct answer: C. Refer for evaluation. Rationale: may indicate endometrial cancer. Strategy: any postmenopausal bleeding equals abnormal. Question 10. Common symptom of uterine fibroids. A. Painful intercourse. B. Heavy menstrual bleeding. C. Hot flashes. D. Amenorrhea. Correct answer: B. Heavy menstrual bleeding. Rationale: fibroids and large uterus causing menorrhagia. Strategy: fibroid equals flow and fullness. Question 11. Which test screens for cervical cancer? A. CA-125. B. Mammogram. C. Pap smear. D. Ultrasound. Correct answer: C. Pap smear. Pap smear detects precancerous cervical changes. Strategy: cervix to pap smear, ovarian to CA-125. Question 12. A woman complains of vaginal itching, white discharge like cottage cheese. Cause: A. Trichomonas infection. B. Candida albicans. C. Bacteria vaginosis. D. Gonorrhea. Correct answer: B. Candida albicans. Rationale: thick, white discharge with itching indicates yeast infection. Strategy: white plus itch equals yeast. Question 13. Which contraceptive protects against STIs? A. IUD. B. Oral pills. C. Condom. D. Diaphragm. Correct answer: C. Condom. Rationale: only barrier methods prevent STIs. Strategy: barrier equals protection. Question 14. A nurse teaching menopause expects which symptoms? A. Vaginal dryness and hot flashes. B. Increased fertility. C. Heavy menstrual flow. D. Breast enlargement. Correct answer: A. Vaginal dryness and hot flashes. Rationale: estrogen decline causes vasomotor and urogenital symptoms. Strategy: low estrogen equals dryness and heat. Question 15. Which is a risk factor for cervical cancer? A. Early sexual activity. B. Late menopause. C. Null parity. D. Low-fat diet. Correct answer, A. Early sexual activity. Rationale: early exposure to HPV increases risk. Strategy: HPV plus early sex equals high risk. Question 16. A nurse prepares a woman for colposcopy. What instruction is appropriate? A. Eat breakfast. B. Avoid douching 24 hours before. C. Drink fluids during the test. D. Expect general anesthesia. Correct answer, B. Avoid douching 24 hours before. Rationale: douching alters cervical cells and may mask abnormalities. Strategy: maintain natural vaginal environment before test. Question 17. Common sign of ovarian cancer. 1. Irregular periods. 2. Early satiety and bloating. 3. Vaginal bleeding. 4. Itching. Correct answer is 2. Early satiety and bloating. Rationale: ovarian cancer symptoms are vague. Abdominal distension and fullness. Strategy: silent killer presents with abdominal bloating. Question 18. A woman on Depo-Provera should be taught: 1. It protects for 6 months. 2. It causes permanent infertility. 3. It can cause weight gain and delayed fertility return. 4. It is taken orally. Correct answer is 3. It can cause weight gain and delayed fertility return. Rationale: ovulation suppression can persist for months after stopping. Strategy: Depo equals delay. Question 19. A woman experiences dysmenorrhea. Which drug relieves it? 1. Paracetamol. 2. Ibuprofen. 3. Morphine. 4. Diazepam. Correct answer is 2. Ibuprofen. Rationale: NSAIDs block prostaglandins responsible for uterine cramps. Strategy: pain from prostaglandins equals NSAID fix. Question 20. HPV vaccine is recommended for 1. Women over 50. 2. Males only. 3. Adolescents before sexual activity. 4. Pregnant women. Correct answer is 3. Adolescents before sexual activity. Rationale: prevents HPV infection and cervical cancer risk. Strategy: give before exposure, ideally ages 9 to 26. Question 21. A woman with vaginal discharge has fishy odor and gray discharge. Likely cause: A. Candidiasis. B. Trichomoniasis. C. Bacterial vaginosis. D. Chlamydia. Correct answer: C. Bacterial vaginosis. Rationale: fishy odor, a mean smell, is hallmark of BV. Strategy: fishy gray equals BV. Question 22. A client reports pelvic pain worsened with menses. Diagnosis likely: A. Endometriosis. B. Fibroids. C. PID. D. PCOS. Correct answer, A. Endometriosis. Rationale: pain from ectopic endometrial tissue during menstrual cycle. Strategy: cyclical pelvic pain equals endometriosis. Question 23. After a hysterectomy, which finding should be reported? A. Scant vaginal bleeding. B. Pain rated 4 out of 10. C. Absence of bowel sounds. D. Heavy vaginal bleeding. Correct answer, D. Heavy vaginal bleeding. Rationale: indicates possible hemorrhage. Strategy: post-op equals monitor bleeding and infection. Question 24. Which hormone triggers ovulation? A. FSH. B. LH. C. Estrogen. D. Progesterone. Correct answer, B. LH. Rationale: LH surge causes follicle rupture and ovum release. Strategy: LH equals let's hatch. Question 25. A woman on HRT reports calf pain. Nurse's priority: A. Document finding. B. Stop HRT and notify provider. C. Encourage ambulation. D. Apply cold compress. Correct answer, B. Stop HRT and notify provider. Rationale: possible thromboembolism from estrogen therapy. Strategy: HRT plus pain equals DVT rule out. Question 26. Purpose of Kegel exercises. A. Prevents infection. B. Strengthen pelvic floor. C. Decrease libido. D. Aid ovulation. Correct answer, B. Strengthen pelvic floor. Rationale: improves tone and reduces urinary incontinence. Strategy: Kegel equals control. Question 27. Which statement indicates understanding of diaphragm use? A. Leave it for 2 hours after intercourse. B. Use with petroleum jelly. C. Remove immediately after sex. D. Reuse without washing. Correct answer, A. Leave it for 2 hours after intercourse. Rationale: spermicide must stay in contact to kill sperm. Strategy: keep in place at least 6 hours. Question 28. What is a common side effect of tamoxifen? A. Hot flashes. B. Hair loss. C. Weight loss. D. Hyperpigmentation. Correct answer, A. Hot flashes. Rationale: estrogen antagonist causes vasomotor instability. Strategy: think anti-estrogen equals menopause symptoms. Question 30. Which infection causes a strawberry cervix? A. Candida. B. Trichomoniasis. C. BV. D. Chlamydia. Correct answer, B. Trichomoniasis. Rationale: protozoal infection produces red punctate lesions. Strategy: strawberry cervix equals trick. Question 31. Post-laparoscopy for endometriosis priority assessment. A. Urinary output. B. Shoulder pain. C. Vaginal discharge. D. Leg swelling. Correct answer, B. Shoulder pain. Rationale: CO2 used during procedure irritates diaphragm, causing referred pain. Strategy: reassure, common and temporary. Question 31. Normal pH of vagina and reproductive age women. A. 2 to 4. B, 5 to 7, C, 7 to 9, D, neutral. Correct answer, A, 2 to 4. Rationale: acidic pH prevents infections. Strategy: acid protects. Question 32. A nurse teaches about breast cancer screening. When should mammography begin? A, age 20, B, age 30, C, age 40, D, age 50. Correct answer, C, age 40. Rationale: recommended annually starting at 40 unless high risk. Strategy: 40 equals first routine mammogram. Question 33. Which client is at greatest risk for osteoporosis? A, 35-year-old male, B, 55-year-old woman on HRT, C, 60-year-old woman postmenopausal, D, 25-year-old athlete. Correct answer, C, 60-year-old woman postmenopausal. Rationale: estrogen deficiency accelerates bone loss. Strategy: estrogen protects bones. Question 34. A client with vaginal dryness should be taught to A, avoid lubricants, B, use water-based lubricants, C, use powder for dryness, D, increase caffeine. Correct answer, B, use water-based lubricants. Rationale: safe, effective, and non-irritating. Strategy: avoid oil-based damages condoms. Question 35. Purpose of pap smear: A, detect pregnancy, B, detect cervical cancer, C, detect ovarian cyst, D, detect STIs. Correct answer, B, detect cervical cancer. Rationale: identifies dysplasia before malignancy. Strategy: cervix equals pap. Question 36. Which hormone dominates luteal phase? A, estrogen, B, progesterone, C, LH, D, FSH. Correct answer, B, progesterone. Rationale: maintains endometrial lining after ovulation. Strategy: P equals preserve. Question 37. A client on clomiphene, Clomid, should be informed of A, increased risk of multiple births, B, reduced ovulation, C, delayed menses, D, permanent infertility. Correct answer, A, increased risk of multiple births. Rationale: stimulates multiple follicles. Strategy: Clomid equals twins. Question 38. Which hormone rises just before ovulation? A, LH, B, FFH, C, estrogen, D, progesterone. Correct answer, A, LH. Rationale: LH surge triggers ovulation. Strategy: LH surge equals release egg. Question 40. A woman reports itching after antibiotic therapy. Cause likely: A, candida overgrowth, B, BV, C, trichomonas, D, STI. Correct answer, A, candida overgrowth. Rationale: antibiotics kill protective flora. Strategy: broad antibiotics arrow yeast risk. Question 42. During breast assessment, dimpling is noted. The nurse suspects A, fibrocystic changes, B, breast cancer, C, mastitis, D, benign cyst. Correct answer, B, breast cancer. Rationale: Dimpling equals skin retraction from tumor. Strategy. Puckering equals pathology. Question 41. The nurse should advise a perimenopausal woman to increase intake of A. Vitamin A, B. Vitamin D and calcium, C. Vitamin C, D. Iron. Correct answer. B. Vitamin D and calcium. Rationale. Prevents bone loss. Strategy. Estrogen down, bone down. Question 42. Which hormone thickens the uterine lining? A. Estrogen, B. Progesterone, C. LH, D. FSH. Correct answer. A. Estrogen. Rationale. Builds endometrium in the follicular phase. Strategy. Estrogen equals enrich. Question 43. Which test confirms menopause? A. Low LH, B. High FSH, C. High estrogen, D. Low progesterone. Correct answer. B. High FSH. Rationale. Ovaries no longer respond, causing FSH rise. Strategy. FSH high equals failure to respond. Question 44. A woman with amenorrhea should be first evaluated for A. Thyroid disease, B. Pregnancy, C. PCOS, D. Stress. Correct answer. B. Pregnancy. Rationale. Always rule out pregnancy first. Strategy. Missed period equals check pregnancy first. Question 45. Which infection is reportable to health authorities? A. BV, B. Trichomoniasis, C. Chlamydia, D. Candida. Correct answer. C. Chlamydia. Rationale. Nationally notifiable STI. Strategy. Chlamydia equals compulsory report. Question 46. Which contraceptive is contraindicated in smokers over 35? A. IUD, B. Oral contraceptives, C. Condom, D. Diaphragm. Correct answer. B. Oral contraceptives. Rationale. Smoking plus estrogen equals thrombosis risk. Strategy. Smoker plus estrogen equals danger. Question 47. Purpose of CA-125 test. Correct answer. B. Detect ovarian cancer. Rationale. Tumor marker for epithelial ovarian cancer. Strategy. CA equals cancer antigen. Question 48. A client reports vaginal dryness and mood swings. What is the most likely cause? A. PCOS, B. Pelvic inflammatory disease, C. Menopause, D. Endometriosis. Correct answer, C. Menopause. Rationale. Decreased estrogen levels during menopause cause dryness, mood changes, and hot flashes. Strategy. Estrogen down equals dryness, heat, and mood changes. Question 49. Which instruction is most important for a woman using an intrauterine device, IUD? Correct answer A. Check string placement after each menses. Rationale. Ensures IUD is still in place and prevents unnoticed expulsion. Strategy. Teach client to check for string monthly to confirm placement. Question 50. A client undergoing treatment for cervical cancer with radiation reports watery vaginal discharge. The nurse should A. Document as normal finding. B. Stop therapy immediately. C. Notify the healthcare provider. D. Apply vaginal cream. Correct answer? C. Notify the healthcare provider. Rationale. Watery discharge can indicate radiation necrosis or fistula formation, which require medical assessment. Strategy. Any unusual discharge post-radiation equals report promptly. If you stay till the end, you're already ahead of 90% of Nclex test takers because consistency wins every single time. Now tell me in the comments, which question challenged you the most? And did you spot the strategy pattern I mentioned earlier? Your comment might be the next one I feature in our next Nclex video. If this helped you, don't forget to like, subscribe, and turn on the bell because we drop fresh, real exam level Nclex practice every single week. Keep pushing, keep learning, and remember, your RN license is not a dream. It's your next reality. See you in the next one. Only on Nclex Made Easy 91.